So by all accounts, Helen Joseph Hospital is bursting at the seams as it battles an influx of patients. And it's all due to the closure of parts of Charlotte Maxeke Academic Hospital after a fire there last year. For more on the story, we're joined in studio by Zikhona Tshona, who visited the hospital yesterday. We're also joined via our video link by a patient, Vuyokazi Phikelela, and the South African Medical Association's chairperson, Dr. Mvuyisi Mzukwa. Dr. Mzukwa, I want to begin with you this morning because I want to get a response to what you just heard in the package that Zikhona Tshona filed here on the channel. It's backed up by an account by the head of emergency at Helen Joseph as well, who spoke to us here on Newzroom Afrika channel 405, talking about patients camping outside the corridors of the emergency center, psychiatric patients who are there for 2 weeks. There's one toilet. There's medical waste that's piling up. Dr. Mzukwa, on the face of it, surely this is a disaster.
Good morning to you, Michelle, and to your guests and your viewers. Surely this is a disaster. Healthcare is in crisis. I don't know if there's no better way to explain it. If it's not only that hospital, all hospitals, most of them around the country are experiencing a similar picture. So it's really disappointing and disheartening, that healthcare professionals and patients have to face, poor management of hospitals and, the corruption that is in there and also, disregard of human dignity. If I may put it so, and it impacts negatively on the quality of services, that must get into there. Absolutely.
Just a note for our viewers, we have reached out to the Department of Health in Gauteng. In fact, we've done so numerous times. We were told that there was a communique issued, I believe it was around the 9th of March, insofar as this challenge at Helen Joseph is concerned. The department declining to take part in this discussion today, saying that there will be a briefing by the health minister tomorrow. Dr. Mzukwa, you talk about the impact on patient care. Let's bring in Vuyokazi Phikelela. Vuyokazi, you were a patient or you visited the hospital recently. Tell us about your experience.
I was sick on that Friday. I think it was last week. I thought that it was just nothing. Till the evening, I got worse. Then my boss, Tendi, was so worried. She asked me to go to hospital, and I thought it was just that I couldn't stand, I couldn't breathe. Then I ended up giving up, thinking that, okay, it's a matter of life and death. I must go to hospital. Then the first thing, when we entered there, it was around, it was 9:15 in the evening. Then we got there. Then the first thing, when we entered there, I don't know, it's a receptionist or area or whatever. Then we got in there, both of us. First thing, the lady that was there, she was like cross or angry with us because she said, go out. I'm still busy, I'll call you. Then we did go out and just stay on the benches outside that room. Then after that, we could notice that, okay, there's nobody in now. Then we entered. Then she was still cross, like, I don't know whether she was cross or she was frustrated. Then she said, who's sick? And Tendi pointed at me and she said, okay, you go out. Then Tendi went out. So for me, even that was rough. And after that, she gave me 2 papers and she said to me, go there and give this one. And I didn't know where to go. I asked her where, and she said go, and I just felt that, okay, I'll see outside where I'm going. Then I went out. Then I just gave the other paper to Tendi to see where she's going because we were not sure where to go. Then I turned the other corner, then I found, okay, there's another counter there. Then I went to that counter. Then I noticed that, okay, that's where I'm supposed to bring this paper. Then after that, they appointed me to another room. That room, there were patients, and these metal chairs, if I can say, and the wooden, not chairs, benches, and the wooden benches, and people there were terrible in pain, groaning in pains, and we were sitting there, and I was in pain. My chest was so bad. I was like rolling inside of me because of pains, and we were staying there, we were sitting there, and I was thinking that in this time of COVID, we are just mixed here. We don't know who's suffering from what. Others, they got drip. Some, they got drip. Some, you don't even know what is the problem. And they were calling us, maybe calling somebody, maybe you would say after 2 or 3 hours, they call somebody.
And when did you see a doctor, Vuyokazi?
I didn't see a doctor that night. I didn't see a doctor. I only saw a doctor Saturday afternoon. It was, I think it was around 4 to 5. I think it was after 5 by the time I saw the doctor. So,
Dr. Mzukwa, I mean, going to hospital with chest pains, unable to breathe, being sent from pillar to post, being forced to wait with other patients who are facing their own goodness knows what challenge. 9 p.m. on a Friday, Vuyokazi sees a doctor at 4 or 5 o'clock the following afternoon.
This is exactly what happens, Michelle, when you overpopulate a hospital, when you're supposed to be opening the other hospital like Charlotte Maxeke, because that has a very negative impact on the morale of the staff, but also regarding delivery of services. Because when you populate that hospital with patients, you don't add resources like human capital. You don't add the budget is not adjusted. So it is a problem where you find that there's been a shortage. Even before COVID-19, there's been a shortage of staff. And then if you close hospitals, big hospitals like Charlotte Maxeke, for a year, you are negatively impacting on the morale of staff. I mean, those staff members, they're suffering from burnout. Some, they leave because of that. Some, they make mistakes because if you are under pressure, we are seeing lots of patients and there's no, you're not getting any assistance. What happens? Mistakes happen. The state is still going to suffer from litigation, not because of healthcare workers, because of poor management of the healthcare system in this country. And this is also a disaster, not only to healthcare workers, but also to communities they serve. Because if you have a patient who comes at night and be seen at 12 hours later, I mean, what kind of service is that? Because healthcare workers are under pressure. They cannot take the pressure. Even the professionalism that you should be expecting from healthcare professionals, you cannot get because of the pressure that they're under.
Yeah, absolutely. In fact, Vuyokazi telling us there, Dr. Mzukwa, that she saw a doctor some 20 hours after she first arrived at the hospital. Our reporter, Zikhona Tshona, also was at Helen Joseph Hospital yesterday. What did you see?
And Vuyokazi's story is not isolated because the woman that we spoke to arrived at Helen Joseph at 5 p.m. on Sunday. She only saw a doctor at 1 a.m. the next morning. I think what is concerning is that the dignity of all those patients has been compromised. We've just come out of Life is Dimini. Do lives have to be lost for the Gauteng Department of Health to act? The health workers, they have raised these concerns, and it's concerning that they're also gripped by fear. No one wants to talk. Even the patients themselves, when they are leaving the hospital, I approached many of them who may have witnessed one thing or another, but because they have to go back, they fear that the service that they get will not be the same because they've spoken to the media. Healthcare workers themselves, I spoke to a potter who says, Sisi, we've had it up to here. We are working in fear every single day, but none of them want to speak to the media because they fear that they may lose their jobs. And that should also concern the department. I think this should have been enough for the Gauteng Department of Health to come out and speak about this. As you've mentioned, myself, I also reached out to them. I was referred to that statement that was released on the 9th of March. And then I was asked to provide the details of a story that was in all newspapers yesterday. So what happens? When will the MEC act on this?
That is the big question this morning. And as Zikhona says, we have on several occasions reached out to the Gauteng Department of Health. We've been sent from pillar to post. We've been referred to a statement from the 9th of March. We were told that there would be a response when the health minister gave a briefing tomorrow. Still no comment forthcoming from the Department of Health in terms of these just disastrous things that not only our reporters are describing to us, but patients themselves are telling us of their experiences. Let me thank our guests for their time this morning as well. Dr. Mvuyisi Mzukwa is the chair of the SA Medical Association, and Vuyokazi Phikelela, we hope that you are recovering well now, a patient at Helen Joseph Hospital. Zikhona Tshona here with me in studio, giving us a sense of what she saw and what she was told at Helen Joseph Hospital.